Good evening and welcome to another informative episode of the Skin Therapy Show. I am your host, Sarah Ndanu. As always, we bring for you experts in skincare who are ready to talk everything skin. Today we are at the luxurious Revitalize Wellness Center. So come with me and let's see what we have in store for you. Joining me on set today is Dr. Pancholi. Welcome on set.
Thank you.
For those who don't know you back at home, tell us a little bit about yourself, what you do, and how long you've been doing this.
Okay. I studied dermatology at Harvard Medical School 8 years ago and then came back to Kenya, and now I practice dermatology and cosmetic medicine and cosmetic laser surgery at Yaya Center in Nairobi.
You've spoken about laser surgery. Please expound on that and what is that all about?
We have a lot of different lasers that we use to treat different conditions in the skin. A very common treatment that everybody is now getting is laser hair removal. Yeah? So for ladies who have hormonal imbalances, and sometimes the hormonal imbalances give rise to a few hairs and a mustache and things like that. So for that, we do laser hair removal. If you're going to the coast over Christmas and you want to get your bikini line waxed, now instead you can have it lasered because laser is permanent. Yeah.
All right.
Yeah.
So wait, what you're trying to say is that when I have laser hair removal, I will never have hair in that particular area?
Absolutely. You need between 6 to 10 sessions to complete the treatment.
Okay.
And the laser that we have is actually safe on dark skin. That's a very important question you need to ask before doing a laser treatment. But after 6 to 10 sessions, the hair doesn't grow. So even if it's the underarms, because you know, ladies, when they want to wear something short, the first thing they do is, I have to wax or I have to shave. Yeah. But now with laser hair removal, which is permanent, you don't have to think about that anymore.
Wow, that's amazing. I shall try that. Now, apart from laser hair removal, what other laser surgeries do you have? Do you offer?
We offer laser treatment for dark spots, laser treatment for melasma. We do laser treatment for leg veins. We do laser...
Stretch marks?
Yes, we have a laser treatment for stretch marks as well. And everybody gets very interested as soon as I mention laser treatment for stretch marks, because most women from the age of 18 onwards do have stretch marks.
Yes.
And what happens is with laser treatment, we are able to reduce the visibility of the stretch marks by 60 to 90%. Stretch marks once formed don't go away completely. And we are able to make a difference, but the expectations have to be realistic. But we have had some amazing results when it comes to laser treatment with stretch marks.
What are the common facial problems that you've handled?
Acne is one of the most common problems that we get. Teenagers are prone to acne. However, we have adult acne as well. And as I'm sure you're aware, even contraception can bring about hormonal imbalances.
I've actually dealt with that before.
Yes, yes, absolutely.
Yes.
So when contraception starts causing an imbalance between our estrogen and our testosterone, and we actually, it's like a seesaw, yeah? Both men and women have estrogen and testosterone. And sometimes, for whatever reason, if the contraceptive pill causes a slight increase in our testosterone, yeah, then if we do a blood test, the levels will still come back normal, but it's a very minimal increase. And what this does is this causes the sebaceous glands in the skin that secrete oil to start hyper-secreting. And when these start hyper-secreting, then we get excessive oil. Now we have excessive oil. The skin is shedding itself as it does every 28 days. Yeah, and then we have dirt, dust, and sweat from the atmosphere. Now this clogs the pores. So we have a cake, a microscopic cake blocking our pores of sweat, dirt, oil, and dead skin. And once this clogs the pores, then the skin can't breathe. Now, the sebaceous glands are still secreting more oil. So what happens is the oil gets stuck underneath the skin and it becomes a nice, juicy little cyst, which the bacteria love. So then the bacteria come in and they also attack the acne cyst. And that is actually what we describe as the genesis of acne or the pathophysiology of acne.
How do I know if I use this contraceptive, it will affect my skin in a negative way? Is there something to?
A lot of times it may be hard to tell because we're all human beings and we're all very different. One man's meat is another man's poison. What may work for you may not work for me, for example. But in general, if you're going to take a contraceptive, then you need to discuss it with your gynecologist. However, I would recommend Diane or Yasmin, which are also used for the treatment of acne at the same time.
All right. We will now take a short commercial break, but when we come back, we'll be talking about treatment and prevention of some of the skin diseases. Do not go so far. Welcome back. You're watching the Skin Therapy Show, the right information that I personally needed to hear from Dr. Pancholi. But how many of you actually know what skin types you are? Before you can start taking care of your skin, you need to know what to do. And that's why right now on the show, I'm joined by Doris Atieno, who's a beauty consultant. She says she does this for her passion, but it would be nice to not preempt what she's going to say, but give her a chance to briefly introduce herself and tell us about what you have been doing, Doris.
My name is Doris Atieno, a beauty consultant. I've been doing this for 6 years now. Yeah.
That's a long time.
I do it as a passion. Yeah.
Can you briefly take us through some of the skin types that we've got before you can show us how exactly to know this X type of skin?
Yeah. We have dry skin, combination skin, and we have oily skin. Yeah. Sometimes we go to the shelves or supermarkets, we buy products to use on our skin, but you don't know if you're dry skin, combination skin, or oily skin. So you have to do a skin test for you to be sure. Yes.
And let me ask, must it be done by a professional or can you do it at home? Because most people were looking for an option that I can easily go with. I do not want something complicated, something costly. I'm looking for something free, quote unquote. Yeah. So is it something that you can do at home, and what would that mean?
Exactly. We have machines which can do that, but nowadays with technology we have strips. You can do it at home. We have strips such as these ones. You carry them in your bag. You can go anywhere at home and do the skin test, and you get. We have result chart. You check your skin type through this.
Enough with my talking. It's time to go down to business and get to know what skin types we are. I hope I'll be lucky to also get to know what my skin type is, because I don't know. But take us through the demonstration and maybe tell us what you're going to do and how it works.
Yeah. First of all, I'm going to wipe her. I wipe her forehead and cheek. This is called a quick and easy skin tester. So you just wipe here, the cheek and forehead. I'll take my cotton.
Yeah.
If you have makeup, you can use makeup remover. If you don't have much makeup, you can just use a damp cotton with water. Yeah.
The whole point is to test the skin with nothing on it.
Exactly.
Okay.
For you to get a good result.
Okay.
Yeah. wait for it to dry for like a second. And then I'll place my strips, one on the forehead, the green one on the cheek, and the gray one on the forehead. As you can see, they're clear. I'm going to place them now.
Okay.
Where I've white for 15 seconds.
Are there times when the result for this and the result of that differ, and what would cause that to happen?
Never. They can't differ.
Okay.
Yeah. 15 seconds are over now.
I should believe so.
So as you can see, this one has some spots on it.
Yes.
And this one doesn't have much. Yeah.
So how do you interpret this result?
She's combination skin. Yeah. Part of her cheek is a bit oily. It has moisture, and her forehead is a bit dry. Yeah.
So in such a situation, what sort of products do you use? Because I do not know if there are products in the market that come in combination.
We do have.
Okay.
We do have products for combination skin. If you're dry, we do have products for dry skin. If you're oily, we do have products for oily skin. Yeah.
From your paper result, there is a spot, there is a piece of paper that does not have as much spots, and there's one that has much. So what is the difference?
Okay, the paper which comes out with, which doesn't have any spots, that's a dry skin.
Okay.
Yeah, it's a dry skin. But like hers, it has some spots on it. Not very much, not a lot, but it has some dots on the paper. That's combination skin. With the oily skin, you can see this all over the paper. Yeah.
All right. Last but not least, maybe you can quickly remind us why it is important to get to know your skin type. And if you have any final thoughts, give us as well.
Yes, it is very important to do a skin test. Yeah. First of all, you have to know your skin type before you go out there to pick a product on the shelf to go and use at home. You have to know your skin type. After that, you'll be able to go to the shelves. You see if you have a dry skin, you pick a product for dry skin, or someone can recommend for you. Whoever who is doing the skin test will recommend which products you can use and which one you can choose. Yes.
I must say you have very beautiful skin yourself.
Thank
When I
you.
grow up, I want my skin to look like hers. But anyways, what excuse have you got now not to take care of your skin? It's very easy, 15 seconds, and you get to know how best to take care of your skin. This is a skin therapy show. Do stay with us. Welcome back to the Skin Therapy Show. I'm your host, Sarah Ndano, and I'm here with Dr. Pancholi. Now, Pancholi, let's talk about how diet affects our skin.
Diet plays a very important role with our skin. You want to have foods rich in antioxidants and vitamins. Carrot juice is quite good, blueberries, blackberries. You want to have olive oil in your food. Tuna fish is good. Green tea is quite good. You want to have at least 2 to 3 liters of water a day, and you want to avoid oily fatty foods and trans-saturated fats.
Dr. Pancholi, you've talked about using olive oil and tuna. And someone watching is thinking, this is very expensive for me. Are there any cheaper methods to maintain a flawless skin?
Now, fish in general is quite good because it has high contents of omega, which are good for the skin. The other home remedy that I would like to recommend is you take some honey, sprinkle a little bit of sugar in it, and then squeeze a lemon, mix it up, and then use it as a facial scrub twice a week. What this will do is this will help clear up the complexion, and vitamin C from the lemon has been known to give a nice glow to the face.
Okay. Dr. Pancholi, when I came to your clinic a few months ago, you used the chemical peel to cure my acne. Tell us more about the chemical peel, how many types we have, and other treatments for acne.
if I recall correctly, we did a fruit peel on you,
Yes.
which is glycolic acid, which is made out of sugarcane. There's different kinds of chemical peels that we use. We have the alpha hydroxy acids, we have the beta hydroxy acids, and we have the polyhydroxy acids. Now, basically what happens is, with all these different peels, we want to peel off up to a certain extent of the skin. So we have the superficial peels that we'll use for fine lines and mild acne. We have the medium strength peels that we'll use for pigmentation and cystic acne, and then we have the deep peels that we use mainly for anti-aging. Now, the way a chemical peel works is it's applied superficially on top of the skin, and once applied, it's left on for a certain amount of time, and then what happens is after 2 to 3 days, you notice that your skin starts peeling, and you can actually peel off the top layer of the skin. And when the skin comes out, then it allows fresh and healthy skin to grow from underneath. And when the top layer of skin comes out, it comes out with all those blocked pores and the clogged dead cells and everything that we had talked about. So all this comes out and you get a new vibrant skin coming out. And
you actually feel younger.
absolutely, absolutely. And somebody was asking me, Daktari, if I peel off all my skin, won't there be a time when I won't be left with any skin? And the answer to that is chemical peels actually cause stimulation of collagen. So they cause fresh and healthy skin to actually grow. So you're stimulating skin, so there's no way you'll peel off all your skin. So it's not something to be worried about.
Okay. Is there a particular age when you're meant to start using the chemical peel, and how many times can you do this in a year?
I have some patients that come for a monthly chemical peel.
Oh.
Yeah, it helps with anti-aging, it gives you a good glow, and it keeps your fine lines and wrinkles at bay, and it helps reduce pigmentation. Why wouldn't you do it?
How many sessions for you to have results?
Between 3 to 5 sessions in general.
Okay.
And you're normally okay.
I will now be reading some of your questions that you have sent on Twitter. Dr. Pancholi, someone is asking, hi, Dr. Pancholi, you're very inspiring. Thank you so much. I suffer from pigmentation. How can I be treated for this? And someone else is saying, hi, Dr. Pancholi, I'm a mother of 2 and my kids are suffering from eczema. What are the best measures and treatments I can go for? And do you offer that in your clinic? Pigmentation
is a very common problem in African skin. And there's different kinds of pigmentation. So I would need to see the skin to be able to assess it. Sometimes we have pigmentation after acne. So basically once we get the breakouts, then the spots go away, but they leave behind dark patches. The other kind of pigmentation that is quite common in dark skin is something known as melasma. And melasma is due to a hormonal imbalance. There's 2 different kinds of melasma. We have the epidermal melasma, which is the top layer of skin, and we have the dermal melasma.